Hello, this is Dr. Vasu Kakarlapudi with Advanced ENT and Allergy. Today we are going to talk about adult tonsillectomy and sinus headaches.
What does the recovery look like for an adult tonsillectomy?
I'll start off by saying a recovery from an adult tonsillectomy is a miserable experience. Some patients actually joke with me that I'm trying to ask if I'm trying to talk them out of surgery. I'm not. I certainly don't try to do that, but I do want patients to have a realistic idea of the recovery after a tonsillectomy. The recovery takes up to 2 weeks, sometimes in some patients even up to 3 weeks. The worst part of the recovery is the pain in this area because you breathe and swallow fairly often, and so you can't isolate the areas that are sore. Plus, there's a lot of nerve endings in this area because breathing and swallowing is a very complex act, and as a result, there's a lot of nerves that travel through this area. The key things for a better recovery is to make sure you're well hydrated. So you want to drink at least a glass of water every hour on the hour is what I tell patients, to make sure that they don't get dehydrated. And to avoid anything that's sharp like potato chips or nuts, instead focusing on soft foods and plenty of liquids. Ear pain is also very common after tonsillectomy due to the referred pain from nerves that travel both to the ear and to the throat. So the good news is after 2 to 3 weeks, you pretty much can expect a full recovery with symptoms hopefully better than what you had prior to surgery.
What is the difference between a sinus headache and a migraine headache?
I think it's important to kind of think about headache in the region of the sinuses can sometimes still be migraines and sometimes can be related to your sinuses. So typically sinusitis-related headaches are typically come with a lot of pressure, nasal congestion, sometimes a foul taste, and facial pain. Migraine headaches typically occur on one side or the other. They're typically oftentimes right around the eye and kind of a deep-seated eye pain. And they typically last longer than and have acute episodes that are really piercing that can last up to a couple of days. Whereas sinusitis-related headaches is more of a pressure, more dull, and seemingly lasting longer. Sometimes the pressure related from a sinus infection or chronic sinusitis can last weeks or even months.